Hey everyone, it's time for us to thrive on Thursdays with the Thrive in Five, where I talk about something super quick that you can use in your anesthesia practice. So this week we were talking about ERAS protocols, and I talked about some drugs that you can use for also pain management, like esmolol, lidocaine, magnesium. So, and there's a post on Facebook for those of you that are on the Surviving Thriving Facebook page. There's a post up that kind of has a few resources of ERAS from the AANA website, just for, conversation starters, things you can look at, talk to with your preceptor. And there's a link there that has like gynae surgery, spine, everything, like all kind of these ERAS protocols, which means enhanced recovery after surgery for these patients. So I want you guys to think of this as kind of this perioperative wellness plan, like this total body wellness kind of movement that we've been moving towards with surgical patients. So I'm just going to briefly kind of give you guys like an overview of it. You guys can read all about it, the actual steps and stuff like that, but I just want to kind of go through a few things to explain why and what you can do. And just to kind of, get you excited for passing anesthesia and all that good stuff. But what does surgery do to patients, right? Like, what are we doing? Whenever patients are undergoing procedure, having anesthesia, what happens? We're basically giving them like a stress test, right? We're stressing their hearts out, right? There is a risk for hypoxia. There's a risk for hypoxemia. There's a risk to increase their demand for oxygen. They are also NPO. They're dehydrated. We are messing with insulin resistance, because when you mount a stress response, your blood sugar tends to get elevated as well. We're giving them opioids. Opioids can cause nausea, vomiting, the addiction crisis that's going on, respiratory depression. And also, patients are at risk for iliases as well, in regards to the NPO, all these things, right? So this is what we're doing when patients are undergoing surgery. So what ERAS is seeking to do and what our job are these things, right? We want to blunt that sympathetic response, right? We want to blunt that stress response as much as we can to all the things, intubating them, putting the LMA in, kind of mitigating the highs, the ups and downs of surgery, knowing the surgical procedures, what steps the surgeon's doing, what's kind of stimulating for them, what's not, so that you can be ahead of the game, be ahead of the curve, and blunt their responses to pain, etc., because that's going to help them in the long run. We want to minimize things. We want to minimize risks to the patients. We want to minimize their pain afterwards, because that can also, delay return of bowel function and them getting up and preventing PEs and pneumonia and all those things. And we always want to be vigilant. That's the super key. That's why we're there, to be vigilant. I say this all the time, especially if you've came to shadow me. We have to know the patient's baseline. What do they look like before, so that any deviation from that norm, be it slight, we know what it is and we can fix it, right? And as we're blunting, as we're minimizing, as we're giving them the anesthesia and doing the job, we're watching closely for any changes, for any, anything that might be going on, and then we're trying to fix that, right? That's kind of the job. You have a sleeping, vulnerable patient in front of you. You have your monitor and your machine. That's all you have, right? To tell you what's going on with that patient. And that is why you guys are working so hard in school, because it's a big job and it's an important job. And you have to kind of know what you're looking for, and you have to practice it day in and day out to, to continue to be good and better at it. We know that also surgery as well, we're activating endocrine system, we're activating the paracrines, these neural mediators, all these things are happening. And so we have to know how to best blunt and minimize those things to take the excellent care of our patient. And that's what ERAS is doing. It's taking a look at the whole picture of what's going on and what can we do to blunt these things, not only intraoperatively, but preoperatively. There's things that go on in the ERAS protocols with not making them NPO as long, and educating them and kind of what the patient's role is. Then we have our intra-op role, and then we have the post-op role as well. So there's this like a whole continuum of things. And like I said, I have all the information up on Facebook for you to look at from the AANA website. And then briefly here, like I know I've been talking a lot about multimodal on Facebook this week, and multimodal just means one or more, like 1+, right? So it's looking at what are all the things in your anesthesia toolbox that you can do to minimize, blunt, you know, all these things to make your patient have this nice perioperative stay with us, right? Their nice wellness plan with us. And that's why I talked about all the different drugs you can use. Like, it's about, like, this is why you're in school, right? You're collecting all these pieces of data, even the cranky preceptors, even the crazy ones, whatever. They have something to offer you, right? Because you're going to learn what to do, what not to do, and everything in between. You're collecting everything right now so that when you get out and practice on your own, you're going to have your own amazing toolbox that you can pull from and use to take good care of your patients. And this is why I know pharmacology is so hard, and you're diving like deep into these medications, and it's difficult, but this is the job. It's knowing about, you know, all the things magnesium can do, what ketamine can do, using your NSAIDs, the gabapentin, Lyrica, tap blocks, neuraxials, spinals, epidurals, putting narcotics in them to try to help the patient decrease IV narcotics later, Precedex, Decadron has a lot of cool usages, Toradol, right? All the things. So that's what you guys are doing right now is you know, the ERAS is that big key word, but this is in essence what you're doing all the time. You're trying to make your patient's operative course be a good one. And you are such an important part of the team. And it's important that you know about these protocols. It's important that you just learn, digest, take it all in, the good days, the bad days, everything in between, study hard, stay up late, get up early, all the things, because eventually you're going to get to sleep and this is all going to click and it's all going to make sense. Okay. So get out there, study hard, head to Facebook, look at the, you know, kind of the ERAS stuff, and just be thinking of what can you do for this patient. Start up conversations with your preceptors, like lead the charge, right? Go up to, you know, when you get out of practice, walk up to surgeons. Hey, would you mind if I try to tap block for this procedure? Here's why, here's X, Y, and Z, why I think this might be good for your patient, right? You're building your own anesthesia practice, right? And it starts with where you're at right now. Okay. So get excited, work hard. I'm here for you guys. If you need anything, Thursday Thriving, 5 minutes. I hope something like that. And I'm cheering you guys on. Okay. Happy Thursday. Have an awesome weekend. Bye, guys.